Healthcare in America, follow the money post. 5. Administrative complexity, the invisible cost. American healthcare is enormous. We've seen who pays and where the money goes, and even traced a single dollar through the system. Now let's examine one of the largest, least visible drivers of cost: administration. Why administration exists. No single entity is to blame. Administrative layers exist because compliance requirements. Hospitals and insurers must follow federal, state, and local regulations. Revenue protection. Providers need billing, coding, and collections departments. Risk management. Insurers need claims review, denials, and appeals processing. Coordination. Multiple payers, network contracts, and patient eligibility require staff to manage flow. Each of these layers solves a problem, but each also adds cost. How it breaks down. Consider a typical hospital: clinical staff, doctors, nurses, therapists, directly delivering care. Administrative staff, billing, coding, claims review, human resources, IT, compliance, legal revenue cycle management, collecting, processing, and reconciling payments from insurers and patients. In the United States, administrative costs account for roughly 8 to 12% of total healthcare spending. That's hundreds of billions of dollars annually, roughly double what similar countries spend. Doctors spend more time on paperwork than in almost any other system. Nurses and support staff spend hours on documentation and prior authorizations. This is why physicians burn out and hospitals struggle with margins, even when they are busy providing care. Administrative complexity versus clinical care. The problem isn't just cost, it's friction. Prior authorizations delay treatment. Coding errors trigger denials. Complex claim systems confuse patients. Every layer of administration increases time, effort, and uncertainty for everyone: providers, payers, and patients. In other words, money spent on administration doesn't directly improve outcomes, yet it is essential to keep the machine functioning. Why you should care. Administrative complexity is invisible to most patients. You see your bills, your deductible, your copay, but rarely the thousands of small interactions behind them. Following the dollar in the previous post, you now understand a significant portion of each premium and tax dollar never touches clinical care. It's diverted to manage, track, and control the system. This is the first clear point where incentives collide with outcomes. The machine works, but it also imposes invisible costs that no one directly sees. Transition. Next, we'll examine insurance design, where financial engineering meets patient experience. This is where the system's complexity begins to influence behavior, choices, and ultimately, cost.